With COVID cases generally trending downward across the country, many have been breathing at least a small sigh of relief, but I haven't been among them. For one reason, the fact that rates are already rising again in some northern states as the colder weather sets in, just like they did this time last year. And two, the death of former Secretary of State Colin Powell at age 84. His family says it was complications from COVID-19 that killed him, despite the fact that he was fully vaccinated. And it's that last fact that worries me and others who actually try to follow the science. Because the anti-vaxxers are already out screaming about how, quote, this just proves the vaccines don't work, while ignoring the condition that weakened his immune system, and that it's the unvaccinated who are still fueling the spread of this virus and killing people like Secretary Powell. So in an attempt to buck that trend here in Massachusetts, yesterday was the deadline for state workers to either get vaccinated or face possible firing. But as of today, more than 1,500 people have neither gotten a shot nor requested a waiver. That's about 4% of active state employees, including several police and corrections officers. Meanwhile, the FDA is still weighing vaccine expansion, with final decisions expected soon on shots for kids 5 to 11 and boosters for both Moderna and Johnson & Johnson, the latter two of which an FDA panel approved Friday. And unlike for Pfizer and Moderna, the panel put no restrictions on who can and should get the additional J&J vaccine.
I think this, frankly, was always a two-dose vaccine. I think it's better as a two-dose vaccine.
Of course, the full FDA isn't bound by that panel's vote, but as the experts keep saying until they're blue in the face, vaccines are the way out of this. The question is, will enough of us ever follow that advice? Joining me now is Dr. Leana Wen, former Baltimore Public Health Commissioner, who's been one of the relentless voices of reason throughout this pandemic as a regular CNN and Washington Post contributor, and she's been among those who've gotten death threats for her troubles. Her new book is Lifelines, A Doctor's Journey in the Fight for Public Health. Dr. Wen, it's a pleasure to meet you. Thanks so much for being here.
I'm glad to join you. I trained at Mass General and Brigham in Boston, and so I feel like even though we're doing this via Zoom, that I am coming home.
Well, we're thrilled to have you back here in Boston. You know, I'm finishing your book this morning, which is a powerful ode to public health, I'd say. And when I take a brief break, I pick up a story in the New York Times, the headline of which is Threats, Resignations, and 100 New Laws, Why Public Health is in Crisis. And they quote the leader of some national public health group saying, we are attacking and removing authority from the people who are trying to protect us. So even if we end up winning this effort against COVID, aren't we losing badly the effort to strengthen public health because of these homicidal governors and legislators across the country?
Yeah, it's an interesting question. Prior to COVID, I thought that the biggest struggle with public health, and the reason why I wrote Lifelines, was that people didn't understand it, that there was, by definition, no face of public health, because public health works when we have prevented something from happening. And I thought the biggest issue was misunderstanding and lack of knowledge of what it is that public health does. Well, I have a different concern now that we are more than a year and a half into COVID-19, which is that public health has been politicized, public health has been put into the center of ideological culture wars, and has now become a partisan issue. That's obviously to the detriment of the issues that we're facing around COVID-19, and things like masking or vaccination have become partisan dividing lines and polarizing issues instead of the necessities to save our lives. But I'm even more worried about what happens after. For example, there are a number of legislatures that have started to putting in new laws to restrict public health authority. And they mean for it to specifically affect COVID-19. But what happens when there's multi-drug resistant tuberculosis? What happens if now people are not trusting other vaccines, and childhood immunizations can also fall off a cliff? I really worry about what public health looks like in the years in the future. And the New York Times article that you cited actually says that we are less prepared for the next pandemic than we were at the beginning of COVID because of all these new threats to public health.
And it seems to me that the infrastructure for all this is misinformation, and the media is elsewhere. There are people like you and Dr. Fauci and Dr. Ashish Jha and the people who work for Joe Biden. But I think it was Susan Glasser who tweeted from the New Yorker months ago that Biden can't vaccinate the public against Fox News. And when you read this morning, after the death of Colin Powell is reported, that John Roberts, a reporter there, says the fact that Colin Powell died from a breakthrough COVID infection raises new concerns about how effective vaccines are long-term. He's since taken it down and said he's pro-vaccine. That's really a dangerous message to send, is it not?
Absolutely. We are facing a dual pandemic of sorts. We obviously have the pandemic of COVID-19, but we also have a pandemic of misinformation and disinformation. Our Surgeon General, Dr. Vivek Murthy, said something about how disinformation is taking away people's freedom, that it's taken away people's freedom to make the best decisions for themselves and their families. He declared disinformation, health disinformation, to be a public health crisis. And I think that's absolutely true. But to the point that you're raising, I think it's very important for us as we mourn the death of the great General Colin Powell. We should also point out that he was 84, that he had Parkinson's disease, he had multiple myeloma, which made him immunosuppressed. And that's very important because he was medically fragile. And also, many people who are immunosuppressed do not mount the full response to the vaccines as healthy individuals. We also have to point out that vaccines are not 100%, and that especially those who are medically frail, that's the reason why we need everyone to be vaccinated, because this is the whole concept of herd immunity, that the vaccines protect you, but they protect everyone the best when we all are vaccinated. And in particular, we get vaccinated to protect the most vulnerable among us.
You know, as you know as well as anybody, there are at least 724,000 deaths from COVID. I'm sure the number is much higher. I would argue, I'm sure you would agree, hundreds of thousands preventable. And you write a story that is so moving, talking about preventable death, about a little third grade neighbor. I think his name was Tony, in your book. Could you tell that story?
Sure. So I did not set out writing Lifelines as a memoir. I actually wanted to tell the story of the work that we did in Baltimore and the incredible people at the Baltimore City Health Department and throughout the city and what we were able to do, for example, in reducing infant mortality in our city by 38% in 7 years, or saving over 3,000 lives from opioid overdose in a 3-year period. But then in writing the story of Baltimore and the story of public health, my editor also convinced me that I needed to write my own story too, because in a way, it's also a story of public health. So my parents and I came to this country as immigrants. I came to the US just before I turned 8 from China. And we had a lot of trouble making ends meet, even though my parents worked multiple jobs. And at some point, we were living in an apartment block where we had a neighbor and they had a young boy who was just a few years younger than me. So I think I was about 10 and he was maybe 7 or 8 at the time. And one day I heard his grandmother screaming for help. And I could see that this boy was struggling to breathe. I had asthma myself. And so I understood how terrifying it was to have that sensation of breathing in, but not knowing if you can breathe out. And you just don't know if you'll be able to take a next breath again. And I could see that there was an empty inhaler. I knew he needed help. But his grandmother was too scared to call 911 because she was afraid that the immigration authorities would come. And the family was undocumented, and she was afraid that they would be deported. By the time she called for help, it was too late. And this young boy had died right in front of me. So I had this sense from an early age that in this country, we do not value health and health care to be the fundamental human rights that they are. And also, I had the sense that we just don't value people the same way. And our society does not value people depending on who they are, where they come from, and whether they can pay. And so that's why I felt so strongly about, in particular, becoming an emergency physician, because I never wanted to turn anyone away who are in situations like this.
But you also, based, I'm sure, on your personal experience that you write about in Lifelines, understand what health equity or health inequity means. And for so many of us who don't do what you do, it's always meant just providing better, more equal health care to people who need it. But as you make clear, if you don't have a decent place to live, if you don't have decent meals during the day, if you don't feel safe in your community, then having the best health care in the world is not going to make you a healthy soul. That's all born of your own experience. Is it not, that understanding?
Very much born of my experience as a child, as an immigrant, but also born of my experience working in the emergency department as well. I mean, I wrote, for example, about another patient of mine, also a child who I got to know well. And it's never good when you know someone well from the emergency department because it means that there's something wrong with the system. But this was a child who came in all the time with asthma. But what he needed was not a better inhaler. What was going on was that he and his mother were experiencing homelessness. They were going in and out of shelters and friends' houses where people around them smoked. At some point, they lived in a row house surrounded by vacant row houses where there was a lot of mold, and they were across the street from an incinerator. So what was making him sick and what we could do from the ER, we could try to give him better medications. Of course, we would do that if he came in. But what he ultimately needed was better housing, because housing in itself, as you said, is also healthcare. The food that we have access to. I mean, what am I supposed to tell a patient who has diabetes and heart disease? Eat better food. But what if she tells me I live far away from anywhere that has healthy groceries? At my corner store, the closest thing that comes to a vegetable is a dried out old banana, and I have to take 2 buses and then walk 10 blocks to get to a Whole Foods, and then it's too expensive for me to afford anyway. I mean, there in Baltimore, for example, where I live, 1 in 3 African Americans live in a food desert compared to 1 in 12 whites. In Baltimore, we have neighborhoods just a few miles apart where an individual born today can expect to live 65 years or 85 years, depending on the zip code that they're born in. That's not just about healthcare. Yes, I'm an ER doc. Of course, I believe in providing exceptional healthcare when people need it. But there is a broader definition of health to which we must aspire as well.
You know, Doctor, long before, I was going to say they became popular, unfortunately they never became popular, long before mandates were being put in place, you were talking about them. You have talked incessantly about how we need a better proof of vaccination system. We don't have one. And one of the things that impressed me most early on when I saw you one night on CNN, long before President Macron decided that you can do the things you want to do, but only if you're vaccinated. Here's the reward that comes with vaccination. You were talking about that. Let people know what they get that they want from vaccination. Is it as simple as politics being the dividing line between doing the obvious that'll get us to the promised land or close and where we are today?
Well, I think that politics and partisanship are a part of it, but I think that there is a deeper problem. We know that public health depends on public trust. I mean, you can get the science right. And of course, I really believe in science. Like, of course, I believe that we need to be making decisions based on science and research and data. But just getting the science right is necessary, but not sufficient. I think part of the issue has been also with the Biden administration and with the messaging by many individuals who are so well-intended and want to do the right thing. But the messaging from the beginning wasn't very clear about the benefit of vaccination. And then at a certain point, there was this 180. Recall back in May when the CDC came out and quite unexpectedly, I think to many of us said, essentially, if you're vaccinated, you don't need to be wearing a mask. Okay, that was fine, except that except without a proof of vaccination, the unvaccinated also felt like they had free reign to go around maskless and remain unvaccinated. And then the messaging became, hey, why should you care? If you're vaccinated, why do you care if others around you are also vaccinated too? But as I wrote in a Washington Post op-ed that I co-authored with neuroscientist Sam Wong from Princeton, we should start to equate remaining unvaccinated to drunk driving. Because in both cases, it's not just about you. It is your choice if you want to be intoxicated in your home or in a bar. But if you get behind the wheel of the car and have the potential to cause danger and harm to other people, that's not just about you anymore. And in the same way, the decision to remain unvaccinated is not just about you. You pose a threat to unvaccinated children. I have 2 young kids, too young to be vaccinated. You pose a threat to immunocompromised people who don't get the full benefit of the vaccines. And you pose a threat also to vaccinated people by having a greater chance of giving them breakthrough infections. And so I think there needs to be this better sense of we're all in this together. And I think that idea of creating this public trust, I think we all need to do a lot better job of. And I do fear to some extent that it's too late to put the toothpaste back in the tube.
Before you go, though, you're human in addition to being a committed doctor. When you walk in the ER and you learn that the patient you have to care for is unvaccinated, what do you feel inside, doctor? I have 30 seconds.
I'm very concerned for that individual, especially as we're seeing more, for example, of pregnant women who are not vaccinated. Look, there are a lot of people who, for whatever reason, have not made this choice that is the right one for their health. I think it's incredibly frustrating for us who know the science, who know the evidence, who also see the impact on other people. But most of all, I'm concerned for that individual because they are 6 times more likely to become infected, 11 times more likely to die from COVID, and that doesn't have to happen.
Well, you're a better person than I am, but that will surprise nobody in this audience. Dr. Wen, it's a pleasure to meet you. Your book is terrific. Thanks so much for your time. I appreciate it.
Thank you very much for having me join you. Thank you for your great work.